Alongside the inconvenience and the pain of a regular period, some women experience prolonged menstrual bleeding for some or all of their cycles. You might find yourself bleeding for 5, 6, or even 7 days, wondering when it will end for you to get back to those white pants. While most of the time, lengthy period bleeding is normal, it can also indicate a number of medical conditions. That's why this video is very important for every woman, especially if bleeding is excessive or your period lasts longer. You get to find out what is the normal length of a menstrual period, what causes or underlying conditions that may cause long periods, what treatments are available for prolonged menstrual bleeding, possible complications from having a long menstrual period, when should you see a healthcare professional, and which healthcare professionals can help. Let's delve in. To begin with, doctors use the term heavy menstrual bleeding to describe a period that is dangerously heavy or long-lasting. That is bleeding more than just having a period that drags on longer than you'd like. It means you are losing so much blood through your menses that you can't maintain your usual activities. Women vary greatly in the range of their cycles. This includes how long they go between periods, typically anywhere from 21 to 35 days. It also includes how long a period lasts. Generally, a period should last 6 days or less, and the flow should start heavier and get lighter. But every woman is different. What's more important is whether the length of your period has changed or not. If you regularly bleed for 8 or 9 days, that's not concerning. But if you previously had a 5-day flow and now you're flowing 8 or 9 days, that should be assessed. Even women in perimenopause, whose periods may be all over the place, are wise to get examined if the length of their period changes markedly. Depending on the circumstances, long menstruation might be a mild condition that can easily be controlled, or one that indicates a more serious underlying health issue. For some women, it may seem as if the bleeding literally doesn't stop, continuing through the entire month. But this isn't usually the case. Since the time between cycles is counted from the first day of your period, a woman who has a 24-day cycle with 8 days of bleeding will experience only 16 days period-free. This may seem like you're always having your period even though you're within a standard timetable. While irregular menstrual periods can be annoying, many are caused by hormonal changes, which are common and rarely mean something serious. Younger girls just entering puberty and older women approaching menopause are most likely to experience these hormonally based prolonged or irregular periods. Usually, a changing level of estrogen is to blame. Estrogen helps build up the uterine lining, called the endometrium, which will support a pregnancy if it is fertilized. If no pregnancy happens that month, the lining is shed as a menstrual period. Doctors use the term abnormal uterine bleeding caused by ovulatory dysfunction when a hormone imbalance is the cause of the bleeding. In some cases, birth control can impact the frequency, duration, and flow levels of menstrual periods. The copper IUD may cause extra bleeding, and while birth control pills usually shorten your periods, it's possible some can have the opposite effect. Changing the type of birth control you use may help with this issue. That said, it's wise to consult your healthcare provider before stopping or altering your birth control strategy so you can understand the potential side effects and risk of pregnancy, as well as devise a plan that's best for you. A wide range of medical conditions can be the cause of abnormal or long menstrual bleeding. These include 1. Uterine fibroids. These non-cancerous growths emerge inside the uterine walls and can range in size from one tiny speck to several bulky masses. Also called leiomyoma, uterine fibroids can lead to heavy bleeding and periods that last longer than a week. 2. Endometriosis. With this disorder, tissue similar to the type that lines the inside of your uterus abnormally grows outside your uterus, sometimes extensively. In addition to excessive bleeding, endometriosis can cause significant pain. 3. Intrauterine device, IUD. Especially in the first year, a copper IUD can cause heavier menstrual bleeding. 4. Pelvic inflammatory disease. This is a bacterial infection in the female reproductive organs. It is most often caused by bacteria acquired during unprotected sex, such as gonorrhea or chlamydia. 4. Thyroid disease. Abnormally high or low levels of your thyroid hormone can cause periods to be long, heavy, light, or irregular. 5. Bleeding disorders. When the blood does not clot properly, it can cause heavy menstrual bleeding. And 6. Endometrial cancer. Though this rare, this cancer of the uterine lining is the most serious cause of prolonged menstrual bleeding. Many other conditions are uterine polyps, endometrial hyperplasia, polycystic ovary syndrome, etc. Remember, any of the above health conditions can cause prolonged menstrual period. Many causes of prolonged bleeding can be treated with birth control pills of estrogen and progesterone. This not only provides contraception, but it can also treat bleeding caused by hormones by regulating hormone levels. Birth control pills generally decrease the overall amount of flow and so should lessen the length of your period. In some cases, such as for endometrial hyperplasia, the hormone progestin may be prescribed alone. Other medicines may also be used. Tranexamic acid is a prescription drug that treats heavy menstrual bleeding. It comes in a tablet and is taken each month at the start of the menstrual period. Prolonged bleeding caused by uterine fibroids can be treated with medication or with minimally invasive procedures such as endometrial ablation, uterine artery embolism, or laparoscopic surgery, popularly known as a myomectomy. In severe cases, an abdominal myomectomy or a hysterectomy may be recommended. Treating endometriosis can be challenging. However, it's possible to manage abnormal bleeding due to the condition using continuous oral contraceptive pills or the contraceptive injection, Depo-Provera. For painful menstruation due to endometriosis, surgery to remove the unwanted lesions seems to provide the most long-lasting results. Often, the biggest problem with having a long menstrual period is the way it impacts your quality of life. If this is the case, don't be shy about exploring ways to change your cycle with your healthcare provider. Also, since blood is rich in iron, women who bleed a lot are at risk of anemia. Talk to your healthcare provider about whether you might need iron supplementation and what schedule you should take it on. Birth control pills generally help with prolonged menstrual bleeding, but on occasion may cause it. IUDs, especially copper IUDs, sometimes cause prolonged bleeding, especially in the first year after insertion. Women in perimenopause, the years leading up to menopause, frequently find their periods changing. Still, even if you're perimenopausal, you want your doctor to check things out. Although long or irregular bleeding may just be from perimenopause, it is also often the first clue of endometrial cancer or cervical cancer. If you have a long period for only one menstrual cycle, there's probably no need to worry. But if you notice a change for 2 or 3 cycles, that's the time to seek out your doctor. Again, you need to see the doctor if there are any significant bleeding between periods without an explanation. And a woman past menopause should have no bleeding at all, and so should see her doctor immediately if she does. Several different types of medical professionals can help with prolonged periods. These include primary care physician, gynecologist, nurse practitioner, physician assistant, and interventional radiologist. To wrap up, long period or prolonged menstrual bleeding should not be taken lightly, since it can lead to anemia, which can cause heart palpitations, chest pain, shortness of breath, headaches, tongue swellings, and many more symptoms. Thank you for watching, and I hope you have been educated. Kindly share this information with others, and don't forget to subscribe to this channel for more health-related content. Until next time, stay safe.